Okay. So actually, I came to know that you people already have that PDF.
Yes, ma'am.
So there is like, I don't think there is much point of teaching through that. So somehow I made some new notes for you, which are more concise and I think relevant. And I try to incorporate some examples also.
Mm,
Okay,
That's great.
because when I saw the PDF, there was a lot of repetition in that.
Mm-hmm. Okay, ma'am.
Okay, so yeah,
Okay,
so
ma'am.
I'll just try to concise things and cover as much as possible in like less time.
Okay, ma'am.
Okay, so yeah, coming to management as a system, open and closed system, we talked a lot about this yesterday. Just trying, give me a second. I'm just trying to find my bottle. Yeah. So now to be very specific, if we talk about any system approach, basically it is a way of thinking about things as whole. Okay, so I think this definition is far better than the definition or whatever matter we studied yesterday. Okay, it is made up of interconnected parts that affect
Mm-hmm.
each other, and basically it is a holistic view which emphasizes on the importance to understand what is the importance of each and every part and how it contributes in the wholeness of a system. Here, I just want to give a simple example of a car. Like a car has multiple parts, but together when they work, they form a system. Okay, and each part has its own importance, and when they work together, then only the whole functionary can work. If there is a issue with any of the part, the whole system is going to collapse. So in similar way, system approach can be applied to anything, from businesses to organization. And as yesterday we talked about the social system. System approach is a very powerful tool for solving problems because it actually helps to see the bigger picture and understand how all the pieces they fit together for functionality of a system. Some of the very in a very like simpler way, what are the benefits? Basically it helps to identify root cause. It helps to be more creative and find out more innovative solutions. Then it also help us to make better decisions by considering all of the factors which are involved. Also, it can help us to anticipate any potential problems and then how to find out solutions for them. Okay, so in your PDF, there are certain, there is like information given about management system, which is open and closed. I try to make it in a tabular form and make it in a simpler way. Okay, so while we are doing a comparison between open system and closed system, there are certain features which can be considered. Like first and foremost is interaction with environment. So if we talk about a open system, yesterday we discussed about inputs, processes, and outputs. Okay, so in inputs, we discussed about human resources, logistics, funding, money, and outputs we talked about like the what are the outputs in form of patients, consumer satisfaction, and all that. So in open system, there are high exchange of inputs and outputs with the external environment. Because if you can recall, in an open system, there is a freeness or there is much more say of external stakeholders. So that is why in this case, there are high exchange of inputs and outputs among the external stakeholder, which can be customer, suppliers, competitors, or any regulations or regulatory authorities. Now, coming to closed system, there are low exchange. There is a low exchange of inputs and outputs. Basically, this system focuses on internal operations. Now, if we talk about another feature, which is adaptability. So, because there are multi-stakeholder engagement in open system, so this system is more flexible because they are open to idea exchange and other like vision inculcation from other stakeholders. That is why this system is more adaptable. And as yesterday we also studied that open systems are dynamic system. So because of this dynamic thing or the transitioning thing, they are more flexible. Whereas if we talk about closed system, these are less adaptable, and basically they are very, very prone to change because they have a very little or no external say or influence. Coming to complexity, uh, open system, because there are many stakeholders involved in this, so these are more complex because all the stakeholders, they have their says, their thoughts, everything is considered. So that's why it creates a kind of complexity. The closed system, as they are internalized, they are following a control environment, so there is simpler these are simpler in comparison to open. Now, as per the definition yesterday for like system, we talked like one of the feature for systems is goal orientation. Okay, so if we talk about open system, they are focused on both internal efficiency as well as they are like open to external demands because they look for sustainability. Okay, whereas if we talk about closed system, these focuses primarily on internal efficiency because, and basically they just want to achieve some predefined goals. So if we talk about certain examples in management, so open systems are modern agile organization, certain project management with constant feedback loops. Whereas if you talk about closed system, they are mostly family oriented businesses, traditional organizations. In their hierarchy, they have a rigid structure, and there is a limited communication. There are no feedbacks, there are no 360-degree feedbacks. So they basically follow the traditional patterns. Okay. Now, this completes your first you can say chapter. I try to like concise the whole chapter in this table. I hope it makes some sense to you guys.
Yes, ma'am.
I think because there was a like lot of repetition in that. They were just banging the same bush. So I
Mm-hmm.
thought it's better to have it in a tabular form. Okay.
Yeah.
Now coming to the second chapter, we can start from here. So basically, it talks about like what are the implication and limitations of system approach. Okay. I also try to give certain examples. So if we talk about implications or benefits of system approach, first is holistic problem solving. Why? Because in system approach, we identify the root cause, which are caused by interconnected parts or as given in your PDF, the subsystems. As we all know that every subset or every part plays a critical role. So if there is some problem in the whole system, we have to identify the particular root cause. Okay. So just a second. Okay. So for example, yeah, for example, there is a manufacturing plant which is experiencing frequent equipment breakdowns. Okay. They analyze, in this condition, they analyze interactions between maintenance schedules and operator trainings, and along with that, raw material quality to identify the root cause. So they can, for example, there is a improper training, okay, or which is leading to misuse of the equipment. So due to this reason, the whole production of the plant might be affecting. So we have to identify what what is the actual reason, which is the part of the whole system which is causing any issue. So that is why in system approach, it actually, this is how it helps for problem solving. Now one more another benefit is improved decision making. How it happens? So basically, because it factors all aspect of a system, leading to more informed choices. So, as yesterday we discussed, there are sometimes there are technological advancements. Certain times there are certain emerging health concern, or sometimes there are more options. So, in this developing world, when there are multiple advancement in many areas, so at that time a system has to update themselves. Okay, and there are multiple options. So to make a choice among these options, system approach help us to find the right choice for us. Okay, so if we talk about an example, for example, a hospital is there. Okay, and this hospital, they wants to improve patient wait times, and sometime they consider not just doctor schedule, but also they consider others factors which are affecting these long queues or long waiting time, like lab processing times are there, then availability of nursing staff, and sometimes even patient flow patterns. So based on these, it helps to make informed decision on resource allocation. Coming to next feature is enhanced innovation. It is very important to understand interactions which actually fosters creative solution that address the whole system. Taking the example of a city which is experiencing traffic congestion, if we consider system approach to resolve this issue, we have to consider multiple things. Okay, we have to touch multiple points, like first of all, though, we have to consider road infrastructure. Then also, like, what are various public transportation options which are available? And one important factor is what is the behavior of users or commuters. Okay, considering all these things, they will help to find a solution which will help in improved public transport. For example, we can surface some carpooling incentives, and this can help in reducing overall congestion. So this is how system approach, when we think of multiple parts as a whole, we try to figure out, okay, so this is the issue, and then we have informed choices, and also we get an opportunity to involve certain innovations. Next is proactive management. Okay, so what is proactive management? Basically, it helps to anticipate problem. How? By considering what will be the potential consequences of action within the system. Okay, so for example, there is a company which considers like they are going to launch a new product. Okay, using system approach. So they will analyze like what will be the potential impacts on production capacity, along with that marketing resources, and potential disruptions also to the existing product line they have now. So this is how they can anticipate these challenges, and in accordance to that, they can find out the they can take timely actions, and they can find out solution and a remedial thing can be done by this proactive management. Now, coming to another feature, effective communication. When we have so many key players in a system, it is very important to understand the needs of each and every department, also to convey them properly, and trust building. There are certain things like trust building is there, or transparency is there, understanding of all SOPs by all departments. So effective communication is very critical. Okay, so for example, we consider example of a school which implements system approach so that they can improve performance of their students. How system approach can be applied here? They have to see the collaboration between teachers, administrators, counselor, and they have to understand like what are the obstacles faced by the students. So by having a effective communication between these stakeholders like teacher, administration, and counselors, it will help to identify the gaps or obstacles faced by the students, and uh, t- um like more more effective solutions can be found out. Now, coming, these were some of the benefits of system approach, but along with that, it also has certain limitations or challenges. The first and foremost challenge is complexity. Okay, why? Why complexity is a challenge? Because open systems are large, they are intricate, and sometimes it is very difficult to analyze them and model them effectively. For example, there is a global chain supply. Okay, it is a complex system. Why? Because it has multiple interacting parts. Like there are suppliers, there are transportation networks, regulations across different countries. So when we analyze and model all these interactions to optimize the entire chain, sometimes it can be very overwhelming. बहुत ज़्यादा जब बहुत ज़्यादा key players हो जाते हैं, so they all have their key thoughts. Yesterday we talked about synergy. It is easy to say than done. So multiple key players, it seems very easy, like okay, everyone has a say, but to bring all of them on the same page, it is a task actually. It is a task. Okay, so this is like this complexity actually sometimes hinders the successfulness of system approach. Okay, coming to another challenge is resource intensive. So when because open systems, they are huge systems. Okay, huge system means a lot of more data, and first of all, to gather these data and implement changes, if we want to like do some innovative implement certain innovative ideas, they can be time consuming and expensive, because you are not trying to modify certain parts. You want that there should be a replacement in the whole system. Okay, so for example, a large corporation wants to implement a company-wide sustainability program using a system approach. So they want to gather data on energy consumption, weight generation, and employee behavior across all branches. So this is going to be a resource intensive task. A lot of human resources required in this. Then there will be time. Lot of time is required, and other logistic logistic things will also be required to carry out this. So that is why it is resource intensive. Now coming to abstract concept. So sometimes what happens, the core ideas of interconnectedness, they can be actually very challenging when we want to translate them for certain specific actions. Like there is a manager who basically who understands the system approach, but when he make a blueprint or a plan to like convey to the team members, it becomes very difficult for him, like how to practice, how to do the pragmatic implementation, so that the teams they can understand and there can be improvement. So this is a challenge because it goes from one person to another. Sometimes it becomes person specific, okay, or sometimes like department specific. As a whole, all the like partners, they don't understand the core concepts. Okay, now another feature is, or you can say limitation, is limited scope. Basically, when we talk about external factors or social, ethical implication, so we may overlook these. Okay. So, for example, a city focuses on improving its education system, but they fails to consider that there might be certain external factors too. Like there might be external factors like poverty or lack of access even to healthy food, and that might be impacting the student learning. Okay, so now efficiency. So when we talk about open system or system approach, there is the expectation levels are too high. Okay, so there is like too much emphasis on efficiency, like it should work at any cost. So in this, what happens? It in this case, the the internal capacity is somehow compromised. Okay, because to prioritize internal optimization is done at the expense of adaptability to changing external environments. Like in case of a company which focuses on streamlining its internal processes for maximum efficiency. Okay. But somehow they fails to adapt to changing customer demand and new technology. Okay. So the internal processes, they become so cumbersome that they basically don't try to like sometimes it is like you get so much involved in fixing the puzzle that you neglect the externalities, how they are impacting your internal system. Okay. So these were certain limitations and benefits. Now, coming to pros and cons of system theory when we talk about management. Okay, so let's talk about pros and cons side by side. So one of the pros is holistic view. In a management, when we apply system theory, it uh, it like emphasize on holistic view. It consider all parts of the organization and their interaction. This actually leads to a comprehensive understanding of problems and opportunities. Wherever the consequences that it is complex, so large and intricate system, they are very, very difficult to analyze and model effectively. They require significant resources to tackle these issues. Improved decision making is there as a pros because it encourages all factors and their interrelationship, which lead to more informed choices. Cons is abstract concept. Okay, the core ideas, they can be challenging to translate into specific and actionable steps. Coming to adaptability, it focuses on the dynamic system. Okay. And a dynamic system can adjust to changes in the environment. And these promote long-term success, or you can say these are more sustainable. Whereas they also have limited scope because they may overlook external factors or social ethical implications which are outside of this defined boundaries of this particular system. Uh, there is an enhanced collaboration because it highlights the interdependence of department, which fosters our teamwork and communication across the organization. Whereas there is also overemphasis on efficiency. Okay, now coming to one of the process, innovation, whereas we understand interaction between parts that can lead to creative solution, which actually address the entire system needs. A cons is resource intensive. Okay, as I already shared that there are challenges while gathering data and implementing changes across a system that can be time consuming and very expensive. Now, can you just give me a second? Just a second.
Okay.
Yeah, just a second. राम मैं करती हूँ आपको करती हूँ राम मैं. Okay, good night. Yeah. Okay. So now coming to what are the limitation of system approach when we are implementing this approach in hospitals. Okay, I try to capture a few of the relevant example. Okay, so actually system approach can be very valuable, very helpful in hospital management. Okay, first of all, like one of the limitation is complexity. In this large hospital systems, they have numerous departments and numerous processes also that can be actually very overwhelming to analyze and model comprehensively. शाहीन और अभिषेक आप सुन रहे हो ना वैसे मुझे?
जी जी मैम.
ओके, तो अच्छा मुझे बताएं इज दिस इज बेटर देन योर पीडीएफ और यू वांट कि वो ही हम फॉलो करें?
मैम ये ज्यादा अंडरस्टैंडेबल है.
नहीं मतलब आई जस्ट थॉट कि अब उस पीडीएफ से क्या ही पढ़ाना है, वो तो आप लोगों के पास है ही.
मैम ये सही है.
मुझे
No, this
मतलब
is
वो
good.
समझ नहीं आया कि आई थॉट कि मैं पीपीटी बना लेती हूँ बट देन उन्होंने कहा कि वही. बट हाँ, आई आई लाइक कवर्ड एवरीथिंग व्हाटएवर इज गिविंग देयर. ओके. Okay, so yeah, we were talking about complexity. So due to like the size of large hospitals or their complexity in terms of departments and processes, sometimes this complexity is very difficult to implement. Okay, like let's take an example of a large teaching or academic hospital which has a research wing. Okay, it has multiple specialized clinic also, it has emergency department. Okay, and they want to try they want to like they try to implement a system wide approach so that they can improve their resource allocation. So in this case, what happened? The sheer number of interacting parts and data points, they basically makes defining boundaries very difficult and analyzing interaction among all these departments. This is a major challenges. Like कोई भी अस्पताल है तो अब जो टीचिंग डिपार्टमेंट है वो बोलेगा कि यार हम ये शेयर नहीं कर सकते. Emergency department, they have their own issues. So likewise, there are multiple departments, so it is very difficult, it is very complex to bring all of them on same page and actually to make this wheel run. Actually it becomes difficult. Okay. I mean, they might not be understanding the holistic approach. They might not be understanding what is like a main goal of this system approach. Okay, they sometimes, every department, they have their own priorities, especially in a healthcare system. Healthcare system, it becomes very, very difficult. Some of the like departments, they are quite neglected. If you compare a teaching department with a emergency department, of course emergency department will say like they have different kind of attendance, they have a different kind of work, so they might like not prioritize like some, for example, if you want to adopt a regulatory things in all over the hospital, so the emergency department might not give it that priority, whereas in case of academic they might give. And sometimes people feel like, for example, the emergency department might feel that they are overburdened, or there might be certain resource constraints, whereas the academic wing, it doesn't have those emergency kind of situation or round the clock duty, or the HR allocation is quite different. So these kind of working like working hours, or working culture, or work commitments, they can basically make the system complex. Okay, and it's becomes difficult. It is one of the major limitation of application of system approach. Okay, now coming to resource intensive. uh, Resource intensive again, there is a lot of data which has to be collected, lot of analysis has to be done, and then implementation through like system wide changing. These can be very task worthy, then they can be very time consuming. And nowadays for data collection, there are certain there are certain softwares for health management information system, other system, there are certain customized system, and they are actually very expensive. Okay, so to collect these datas, it itself is a big task, and to manage them, then we also need training of the people who gather this data, who analyze this data. Then to like a monitoring of this data is also important. Then how it can be utilized to take care of to find certain critical points. These are certain challenges. Okay, so let's consider a example where a hospital, they want to improve, they want to implement a program so that there are less number of errors in medication. Okay, so basically they want extensive data collection on medication administration practices, and also needs of staff training, and potential errors point across all department. So for this, they basically need to hire some more HR resource, and cost for this additional HR, these, as I told you, certain data analysis tools are there, they come at a higher cost. Then of course once these are done, and you find like, okay, uh, these are the pain points, we can work to remove them. So these potential changes to how these medication are dispensing, this can also be a barrier. People might not be open for these adaptations. Okay, then there are limited scope, because system approach may overlook external influencing patient health outcomes. Okay, sometimes um, they only focus on internal factors, and these external factors, they are neglected. Okay, because for example, let's take a hospital which is private hospital, not very expensive, and they try to involve certain innovative technologies for patient screening. Hmm. But then it is a barrier for people who are coming from low socioeconomic status. They might not be able to pay for these facilities and utilize the utilize the services. Okay, so if we take example of a hospital which focus on improving its internal processes so that they can be more efficient. Nowadays there are multiple point of care of devices, okay, which actually help in screening, more accurate screening. And sometimes some hospitals use these technologies so that they can reduce the dependency on doctors, overburden doctors. So there are many such kind of technological administrations which are included in systems nowadays. But in this, like, adoption to these innovative ideas or innovative technologies, they fail to consider like there are multiple social determinants in community, like poverty or certain access to healthy food impact, which can impact patient readmission rates. So further it might need to improve efficiency with the hospital, but this might lead to improved efficiency, but it doesn't guarantee that there will be better patient outcome in the long run. Okay, now coming to the efficiency, it is overemphasized in a system or approach when a system approach is implemented in a hospital. Why? Because they solely focus on internal efficiency, and they sometimes compromise with patient-centered care. Okay, like a hospital which wants to implement a system to streamline patient admissions. Okay, why? To reduce cost. But this new system prioritizes efficiency by reducing the time spent on intake procedure. So they are just focused, okay, so let's, like, for example, the patient admission time, let's take it for like 10 minutes. Okay, nowadays you might have also seen in many hospitals they have their HMIS, and the doctors, as soon as you go, they start entering the data. Like, doctor only doesn't like ask your issues or health issues, they are also made to enter your data, your details. Okay, and in that process somehow they don't give like proper attention to the patients. Okay, because for them it is a liability. Until unless they enter all your details, they might not be able to like, I mean, it's their liability. And they just focus on this. Okay, I want to enter this information. That I myself have experienced this in multiple hospitals. When you go, they just keep on like entering your data. And in all this process somehow you miss the like information from the patient. Okay, so like in this example of also, they want to streamline process, but basically it impacts because the interaction time between doctor and patient, or some nursing staff or healthcare staff and patient, it gets actually very impacted, because they have a, you can say, they have a addressal time. Okay, and they want to focus on that addressal time, and in that they basically don't look into patient's need or patient satisfaction. So this is a challenge that sometimes we want to be efficient, but we lose the essence also. Okay, now coming to abstract concepts. So the translation of broad principle of interconnectedness, it's too much that sometimes for different departments it can be challenging. Like, there is a hospital administrator who understand the benefits of system approach. for improving communication between nurses and doctors. So when he wants to translate this concept into practical steps like implementing new communication protocol, or he want restructuring shifts, handovers actually can be very difficult due to existing workflows and staff resistance. So this administrator, he might be thinking of bringing certain new schedules or certain new, you can say, formulation, but the existing staff, they really want to go as per their current teams. So this abstract concept is one of the challenge. Okay, so this actually covers your second, yeah, coming to this. So these were the implication and limitation of system approach in a hospital-based setting, how they can be used in how they can be used in management. Okay. So I try to cover this first chapter in that I try to cover this first chapter also, and then talking about your second chapter, I covered almost most of the points in my tabular forms. Okay, now we'll start with the third chapter.
Is the system part completed?
Yes. System part is also completed. See, I have already completed these things. I mean, don't go by because, I try to make them in tabular forms now. See, this is your syllabus. Okay. So we have covered management as system. Okay. Then we talked about open and closed system. What are the like features of open and closed system? I already gave you a table also where we are comparing features of both open and closed system. Okay. Then next is like what is system approach? I told you about that. How system approach, what are the features of system approach? What are the implication and limitation of system approach? And also I gave you examples. Okay, you can just see once again. So this is your management as system. What is system approach? There are two types of what are the benefits. Okay, then we talk about open and closed systems, their features. Any issues in this part?
No.
Okay, because you know what, in that PDF there are repetitions. They are talking about the same thing. I mean, don't go on length because they are just repeating the same words, same things. So I think if you want, you can just write that also. But I just try to make it in this tabular form.
Okay, ma'am.
You can like you if you want, you can elaborate these points.
Okay, ma'am.
Yeah, but as per
will
my
this be shared?
understanding, this table is more than enough actually. There is not much you want to devote on that. Okay, after that, your second topic was implication and limitations of system approach. Okay, so here in this table, I have mentioned about features, both features like benefits also. Okay, so as you can see, we have covered 5 benefits. Okay, improved decision making, enhanced innovation, proactive management, and effective communication. So we talk about 5 benefits, we describe about them, and also I try to give certain examples. Is it fine?
Yes, ma'am.
Okay. Then coming to the limitations, again, we have 5 limitations. Okay, we talk about complexity, resource intensive, abstract concept, limited scope, overemphasis on efficiency. we gave their description. Okay, and I also try to give certain examples. So this covers your limitations. Now, what are the pros and cons of the system theory of management? So in again, I try to make it in table and give you like all the pros and cons. I have shortened the abstract, and then limitations of system approach in hospital. Okay, that was given in your PDF. So I actually covered all the limitations and try to concise them with these examples. So these limitations are complexity, resource intensive, limited scope, overemphasis on efficiency, and abstract concept. You people can just go through your PDF also, and if you feel like I have left something, or if you want me to focus on certain paragraphs, you can just write me on group or message me. Okay.
Okay, ma'am.
Does it like make any, is it like making sense, no?
Yes, ma'am. Absolutely.
Yeah. Okay. So now coming to your syllabus, I think we can start with tools of transcription skill. I can start with the introduction today, and rest we can cover tomorrow. Okay.
Okay, ma'am.
So this I thought like your PDF actually gave a like good start when I was going through it. Just a second. See, I was just trying to tell you that as you can see now in this document, implication. So they are in my tabular form, I also talk about the same things. Okay, so actually I try to cover each and every point. There is somehow what I felt is quite a lot of repetition is there. And see this like pros and cons. So I just try to make it in a tabular form so that it is simpler and easy to like understand basically. You can just go through it, and if you feel any issue, you can just come back. Okay.
Ma'am, may you please drop this document in the group?
That Word document?
This document.
Yeah, I'll do that. आप लोगों के लिए तो बनाया है. I will send it. अभी I will share. Okay. And yeah. Okay. So let's start from this. Tools of transcription and transcription skill. So what is medical transcription? It's very simple. It's the process where audio medical information, it is basically typed. Okay, using
And
some audio files.
your
Hello?
screen is stuck. Your screen is stuck.
Yeah?
आपकी screen stuck हो गई है.
Screen struck over here. Just a second. Just a second. Can you see it now?
Yes, ma'am.
Okay. Okay. So I was telling like what is medical transcription. So medical transcription is simple process where like dictated or medical information is typed into records by use of wave audio files, foot pedals, and various other file transfer softwares, programs like Dropbox and ByteScribe. Okay. People who do transcription are called transcriptionist. and they play a very, very important role in maintaining medical records. They are basically, their role is to receive verbal information and then type that information into a word processing program, which can be MS Word or Word Perfect, using any tool which is provided by that particular program. This information, it should be transcribed very accurately. Okay, we all understand, like, whatever information a patient, like patient gives to doctor, or doctor wants to use it, it should be transcribed. Why transcription is important? So that for like for history, like whenever a doctor sees patient history, he understand it properly, and this can be used for in future, it can be used for future referrals also. Actual information is kept by the patient. It can be understand by all the medical fraternity. So that is why this transcription is very important. Okay. What all information transcription carries? Basically, it can be clinical notes, discharge summaries, or any kind of reports, whether diagnosis report, whether some investigation reports, whether there are certain other documents, which relevant documents. So these all need to be transcribed. Why? So that basically to digitalize the things. Okay. To maintain electronic medical records. Now what is happening? It is a very convenient kind of job which transcriptionists do, because they can work from remote areas for companies across the globe. Okay. Now, also in this profession, uh, editing of reports can be done in this particular profession, which are generated by speech recognition software. Okay. Then there are many, they have mentioned about many benefits of people working in these areas, like uh, like medical providers, or they can be hospitals, they can be working in insurance agencies, law offices, or uh, physical therapy practices. These are the basically establishment where people with expertise in medical transcription can work. Okay. Also, in this process, sometimes medical dictation is convert manually also. Okay. One important aspect of medical transcription is that the person should understand. I mean, a linguistic understanding is very important. Medical linguistic understanding is very important, so that whatever a doctor or a healthcare professional is trying to say, or they want to convey, it can be transcribed into proper document. And these documents which are transcribed, which has information, whatever the doctor wanted to share, these are known as medical transcripts, or also medical records. Okay. What all these medical transcriptions include? It can have lab reports, patients medical charts, also patients medical history, sometimes certain procedural records, discharge summaries, clinical summaries, and rehabilitation reports also these contain. Okay. So transcript medical transcription is very important to maintain digital medical records, or what we call medical transcription. So I think we can end now, and I can continue tomorrow on this topic.
Okay, ma'am.
Okay. Okay. So can we like plan a class tomorrow afternoon?
In afternoon, it is not possible.
It is not possible. Then because actually tomorrow I have some professional commitment, and I'll be busy by your 2 o'clock, I think. Yeah, 4:30. Then we can have a class then day after tomorrow. Is it okay?
Okay,
Okay,
ma'am.
ma'am.
Okay, yeah, because then tomorrow, because yeah, I have to leave by I have to be free by 5, means your 2:30. I cannot take class after 2:30. Like
No
I have,
problem, ma'am. We can
yeah,
schedule for the after tomorrow.
yeah, I think that's better. Okay, thank you guys. Thank you. Good night.